Well, good evening, folks. Terence sends his apologies this evening. He is otherwise occupied, so I'm pleased to announce, or introduce rather, David Jones this evening. David has, I think it's fair enough to say now, has been a regular on our talk scene and presents at least once a year, and has done for many years, and has given us some amazing insights into the very early days of the medical service in Dunedin as a community, and a little bit further beyond. Same again tonight with William Purdie, an early Dunedin doctor. So thank you very much, David.
Thank you, Chris. We're going to travel from Scotland to Dunedin. Dr. Purdie was one of the earliest 5-6 doctors here in this city, and he left an environment of cholera and brought chloroform to Dunedin, so the subtitle might be From Cholera to Chloroform. But there are a couple of subtitles or subtracks that go along parallel with this, and I'm going to include something that is From Chloroform to Cholera by Dr. X, which you can think about if you know a little bit of history of those things, and we'll reveal that in due course. So I'm going to tell you a little bit about Dr. Purdie's background, family, his education, and his experiences in Edinburgh before he departed for Dunedin via Glasgow, Greenock. And he had a couple of experiences of epidemics in his practicing time in Edinburgh. And then the voyage of the Multan had events which are well described in several writings about earliest doctors here, especially Robert Volpe Fulton, who's catalogued nearly all the early doctors in Otago. The arrival in Otago wasn't all that impressive, and then he's got to get a house for his family, and I'll take you for a bit of a tour around this city to show you where those places were. And he introduced chloroform and vaccination to Otago, so we'll cover that in detail later. So he was born in Airdrie. I know there are a couple of people in this audience who know where that is, been there. His mother came from Airdrie and his father from a bit further afield. It's about 2.5 hours bicycle ride on today's conditions on Google Maps. So I made an assumption that his father moved to where his mother was living and brought up. He had a couple of siblings about which I know could find very little. You're not meant to read this, it's just going to come up with the extracts from it in a moment, but it was written 4 years before William's birth, and it's in a thing like a gazette or gazetteer of the Larnac County. So I called it a lament to the lack of educational facilities in Airdrie, which, with some quotes out of it, there's a public school at the parish, and that salary might have been pretty thin in those days for a year. Scarcely worth collecting, the writer said. I thought that was a shameful pittance for what was the important part of that writing. This is such a wealthy parish that he came from. There were the 2 schools, but neither had either a schoolhouse or a salary, and the teachers just stayed until somebody gave them a better offer. Donald Trump levies. This writer said, one penny in the pound Scotch all over Scotland with the land tax would, if it was paid to the parochial schoolmasters, would add to their trifling salaries, and didn't complete the rest of the statement on the page that I found. Now, the difficult early life in quotes there comes from writings here out of Otago from descendants relating what they'd heard. Dr. Purdie didn't appear to talk very much about his hard early life, so just little smatterings came up like that. But the important part is that he through hard work and perseverance, and he had an ambition to be a medical doctor right from the start, got himself educated in those difficult conditions of not much education going in the early part of that century. I'd like you to note that he was 25 before he got his apprenticeship under Dr. Walter Rankin, who was one of the Airdrie surgeons. Most of us would have graduated and been out in the practice by then. While he was doing the rounds with Dr. Rankin, he cycled regularly each way 10 miles to Glasgow to go to dissection classes for anatomy. After that, he went to Edinburgh and while he was apprenticed again, attended the classes at the Edinburgh University and qualified in surgery, I note, and went off and did further practice, but at the same time, he continued to study for the MD in Glasgow, in Glasgow. So that was his final qualification. It took him 11 years from the age of 25 to complete. Dr. Rankin gave him these attestations. You'll note it's dated afterwards, and he needed these for his Glasgow MD requirements. Noted he was most exemplary in his attendance and visiting patients along with him, and the zeal with which he applied himself to knowledge and the practice. Notice they called it my shop. That's just to show you where Airdrie is and distance to Glasgow. We're going to cover Greenock a bit later, so I'll bring it up now. And then James Tennant was another practitioner in nearby Breeden Hill, also met Mr. Purdie in the shop of Mr. Rankin, and again, I went out and saw him dressing wounds and perform the lesser operations in surgery, whatever they might be, probably abscess drainages and the like, I suspect, and at the same time attending to his academical studies. And the moral character is unimpeachable as a feature that will come through anything else that I've seen written about Dr. Purdie. So just so that you know where Airdrie is on the map, on an old map that is, and Breeden Hill nearby, that's where his apprenticeships started from, and he went off to get his education elsewhere. Now, as soon as he got his qualification in surgery, he took off on some whaler called the Elizabeth of Hull for about 8 months going around Greenland. There were multiple voyages. And his own writing about, or his own words about that was that the fevers prevailed but none died. And during one of those voyages, he came across a man trying to kill himself with drink, and he bargained with him that if he stopped drinking, William, or Dr. Purdie by then, would stop drinking as well, and he remained a teetotaler ever since that, although he wasn't totally against or opposed it, but he was a strong supporter of the temperance movement here in Otago when he came here later. Now, the curious regulations for MD Glasgow, pretty standard sort of things, you know, notify your intent, etc., and have the attendance certificates, of which those last two would have been part of. But the subjects were all pretty standard, what I would think, for a medical training, except for botany, and they allowed any questions from any of those above subjects to be asked in the examination from Glasgow. How many of us would be able to translate something in from a Latin author, but that was a requirement. So he got himself a reasonable education over a period of time to pass those things, and then to write a treatise in English, fortunately. So he ended up practicing from about 1826 through till the time he left from Edinburgh practice to come to Otago. At the same time as he was studying in Edinburgh, there was cholera epidemic 1 at that same time as he married and started his family. And then a couple of years before he left for Otago, he has another one. So his study time was interrupted a little bit by these events. But he was so favoured for what he did in his Canongate practice. Canongate, I'll show you shortly, that he was made a freeman of the burgh. Now, Canongate at that time was a separate little entity within Scotland. It had its own sort of ruling processes before it was fully integrated. So that was an official recognition for his work and efforts there. And this portrait is down in the Toitu, Early Settlers Museum, one of the finest there. It was done while he was in Edinburgh, which had a fashion of clean shaven at the time. I have no details of the provenance of how that came or was brought to Otago, how it got to be in the Early Settlers Museum. So there's Canongate. It's effectively the same as the Royal Mile and ends up down in the Holyrood Palace at the bottom, or house at the bottom of the Royal Mile, if you've been there. Of some interest, up this part of Edinburgh was where James Young Simpson had been, and Dr. Purdie lived somewhere just over the other side of that there. So there's an overlap that I'll come to shortly. So Dr. Purdie is the main subject tonight, but there are some other physicians and conditions which overlap his story. We've mentioned that, but then Sir James Young Simpson, as he later became the professor of midwifery and gynecology in Edinburgh, and he discovered chloroform. I'll come back to that. And John Snow, a bit further away in London, got to do anaesthesia with both ether and chloroform, and by 1853 was favoured with the request to go and give it to Queen Victoria in her eighth delivery. And he was known also for his epidemiological work following the sources, what he thought were the sources of cholera. So I'll just introduce cholera, and I'll give a little bit of a modern day bit before I go back to Dr. Purdie, but it's a gastrointestinal infection with rice water stool and vomiting, abdominal cramps and the like, and the main risks and dangers are massive dehydration and electrolyte balances. But you can imagine what that might be like on a boat with only a poop deck and a lot of people on board and not very far to go. The rehydration solutions and that are available today, of course, weren't available then, nor IV fluids and antibiotics. So Dr. Purdie had to deal with it in other ways. It had been known as the blue death as opposed to the black death because of the colour that people went when they got so dehydrated and underoxygenated, etc. There's plenty of dreadful pictures online about that. And this picture is mainly to bring to your attention this man with his hand on his nose lest he breathe in the miasma, which was the sort of particles in the air that were the belief of how this condition was transmitted. He's trying to avoid that there. Some really wicked recommendations for what to do about it and how to prevent it. Some might make some sense, like not eating raw veggies and things, or at least the way veggies have been got washed with the water was a risk. And cold water, but then it doesn't make good grammar when heated. And spirits, alcohol is clearly an evil, and if you do have to have a lot, at least lower your intake. And this is from the Sanitary Committee of the Medical Council. Seems a little bit more like a legal thing. This famous painting from Pavel Fedotov, 1848, has got this gentleman out on the floor where it's said that cholera is to blame. Now, the lady there, I don't think that's a defibrillator on the chest, but I wonder what this gentleman here is handling her. And have you noticed these guys over here reading the wine bottle? I don't know whether they're looking for culprits or cures for this condition. So there are three main characters for tonight in relation to cholera, and John Snow I've mentioned already, but he had this theory that it was reproduced in the body and spread through contaminated water, not the airborne versions. And he mapped the public wells around London, Soho, a poor area of London, and later had the handle of the Broad Street pump removed. Now, over in Italy at about the same time, there in Florence, where Pacini was, better known for his Pacinian corpuscles at the ends of nerves, he was an anatomist and he examined the corpses of washerwomen and found an abundance of what he called vibrions in the intestinal cavity. Robert Koch came along quite a bit later, and I'll just refer to him later in the end. So there were three major pandemics of cholera, not just localized epidemics, but pandemics in the 19th century. They always blame India. I often wonder whether there's a sort of a racist bias towards where they put the blame, but don't you notice the Germans see also for the Brits and the bottom line, and the ships coming out of the Bay of Bengal were thought to be the way it came away from India. And then the second pandemic, more than 1 million people died in the Russian Empire. And then in the third, which covers some of the time while Dr. Purdie was still in Edinburgh, came across from Europe towards to Scotland first before spreading down to the rest of UK, Great Britain. This General Board of Health report on the epidemic, it does actually say 48 to 49, but was presented to Parliament printed in 1850. Had a section that I thought a little bit of interest. They declared that England was the healthiest country in the world. Well, we'll re-examine that. Did it last? In a 1 year period in London a bit later, there were over 10,000 deaths and 23,000 in the whole of the UK. And London had the highest fatality rate for any single city of those 19th century three pandemics. Specifically relating to Canongate, where Dr. Purdie was, the spread has been mentioned already, but the sanitary conditions were most effective, and that's not necessarily relating to Canongate itself, which had nearly every close in it lime washed. I don't know what the properties of lime are or how they made that, but it was obviously something that they were using to cleanse the various closes. And what is important is to note that it's described in that report as this poor parish escaped with comparatively little disease. So perhaps that's a tribute to the people in that time, and Dr. Purdie may well have contributed to that because that's when he was practicing there. So this is a little diversion to Filippo Pacini and the Florence 1854 epidemic. Translated, they call it the Asiatic cholera, and he was observed with low magnification, and the small intestine had superficial corrosions in the middle part. You can't see the pictures that are otherwise there, so I brought another one out just so you see what the so-called comma-shaped vibrion is meant to look like. So John Snow down in London is looking at one particular water pump in Broad Street and used a microscope to examine water samples and found that there were white flocculent particles in the samples taken from Broad Street. So he convinced the authorities to remove the handle, and suddenly a dramatic fall in cholera cases. He didn't do the typical pathogen identification process of find a target and see if you can reproduce the disease by transferring it, etc. But he was regarded as, he was a founding member of the Epidemiological Society of London and went on doing a lot more study into this condition, as well as he did for the delivery of anaesthesia, which I'll come back to later. There's where the Broad Street pump was, and the black squares represent cases of deaths connected with the cholera. These days, there's a different type of watering hole at close to the Broad Street pub. Robert Koch came along 30 years later and found the same sort of thing. He discovered these Vibrio cholerae and isolated and was able to demonstrate that this was a causative agent. I think in animals from memory, he's possibly better known for his tuberculosis anthrax research, and the Nobel Prize was more for tuberculosis than anything to do with cholera. But his reputation probably came out of the cholera work. In modern times, our hygiene, safe water, sanitation and stuff are how we go about preventing its spread. There is an oral cholera vaccine, but notice that there have in recent times been some outbreaks in Yemen where there's war-torn disruption to sanitation and the like, and catastrophes. I think Haiti might have also, Jean-Claude might answer that later, when they had their big earthquake. Published last year from the World Health Organization, all the red places are where cholera cases are reported from and have deaths, whereas the blue ones, which includes Australia and New Zealand, we have some cases reported, but no deaths. So coming back to some of Dr. Purdie's journey, the discovery of chloroform by James Young Simpson. Now, some Otago writers of the histories of the medical practitioners suggest that Simpson was a classmate of Dr. Purdie's, but if I'll show you a little bit of chronology that might refute that slightly. It's a busy slide. First of all, Dr. Purdie was 14 years older than Dr. Simpson, and he was 26 when he qualified in surgery from Edinburgh, whereas Dr. Simpson gets his qualification at the age of 16, I find incredible. How much work and from when did he start to gain that? And then he's going on with his subsequent qualifications, and by this time Dr. Purdie has his Glasgow MD, which was his final qualification. And at the age of 28, Simpson is now professor of medicine and midwifery in Edinburgh. And quite a while after that, 1846 is the beginning of the first proper anaesthetics with ether. And a year later, Simpson and some of his friends were looking for some other substance that might be useful as an anaesthetic agent, sniffing things around dinner tables. And one day chloroform comes up, for which he gave very little credit to the chemist in Liverpool that helped him get his hands on it. So the main purpose of this is to show you that although Dr. Purdie was overlapping in practice in Edinburgh at times of Simpson, or the rise of Simpson, you might say, it was only a very small time window of about 2 years in which Dr. Purdie could have picked up how chloroform was being used by Simpson in obstetric analgesia. Dr. Purdie leaves Edinburgh via Glasgow for Dunedin before Dr. Snow even gave chloroform to Queen Victoria. I've got a time scale a bit easier to follow a bit later, but Dr. Snow gave chloroform on a folded handkerchief, and his explanation for that was that it would look a bit crass to open out a whole handkerchief in front of all the other royal people hanging around the birth of Prince Leopold. However, this did break down religious objections where labour was thought to have been something to be endured with pain, and there was still long-standing argument about that amongst the clergy and religious leaders as to whether it was against God's will or law. So Queen Elizabeth wrote, this is 1859, that I had this inestimable blessing of chloroform, and she promoted it a bit amongst others, including her daughter in Germany. So now we get to Dr. Purdie coming to Otago, 1849, and he had two friends in Edinburgh that were very influential here, Captain William Cargill and John McGlashan. who are well represented in this city. They were all dedicated and well-read churchmen. They had this dream of a finer Scotland settlement somewhere away from whatever the riffraff was up there, bringing the best of British and Christian values with them. And one of Dr. Purdie's motivations was effectively to bring Christian help to the natives in New Zealand. There weren't that many Maori in Otago, far less than anywhere else in New Zealand. But of course, Edinburgh had the push with the government agency, the New Zealand Company, which was based in London, to work on this settlement rather than Christchurch or Wellington. So the New Zealand Company's ship is advertised, passages could be paid for, and they inform that an experienced surgeon is appointed by the company and make some mention of the good dietary potential. That is the Multan. 610 tonnes is about twice the size of Captain Cook's Endeavour. And I can't tell where this picture has been taken or how it's been taken, because there's a bit of land just in the background there somewhere. So when he leaves, Dr. Purdie is 52 years of age. His 36-year-old wife and his family joined the ship, the Multan. He had 7 surviving children out of 9 at that point in time, the age range being from 2 months up to 15 years. As a ship surgeon, he has free passage. The whole journey was 104 days. There are 180 people aboard, plus a cow, of which one of the diaries of a passenger bound for Otago contains quite a few amusing anecdotes. And Dr. Purdie brought a goat on board for providing milk for his children. Poultry, I don't know how they contained them, but there was poultry and a good number of pigs, early sheep infestation of New Zealand, you might say, and a couple of dogs that sounded like bedlam. There's no good descriptions I could find of how they performed on the journey. So 9 days out, cholera broke out, and there were a total of 20 cases, of which 9 died. Now that was considered quite a good track record for that time and those conditions, but some were sick for quite a while. John Maclay was an 8.5-year-old boy on the voyage. His diary of events was published quite a lot later in his life, and some memories might be wrong, but he said that the first to die looked very healthy young adults when they came on board, and they left, the first 2, they left 2 orphaned infants, one of which died later in the journey, so only one of that family survived. 5 deaths from other causes, including the fact that they lost their own 2 months when departing, about 3 months old when she died on the ship. And Mrs. Purdie's diary is quite a good source of information. She's about the medical aspects of this voyage, saying that William left from Edinburgh 4 days earlier so that he could go and inspect the immigrants before they embarked. And as they left Greenock, there was a very bad cholera outbreak. Seasickness dogged them almost as soon as they got away from the heads of Scotland out into the open ocean, and she describes 2 remedies, or 3 remedies, and I'll leave you to guess what the wine and might be, but one that we would still laud today is bringing up on deck so that, not the fresh air, but the horizon visual focus is part of helping to quell the motion sickness. So what's the alternative remedy with the wine? I've included in several of the talks here previously. The ubiquitous medicine of the time, brandy. I can't imagine that helping, but that's what they did. So Dr. Purdie had to declare pretty stringent measures to try and contain the outbreak of cholera, and the Captain Chevis used his crew to help enforce them, and it was not explicit exactly what they did, but it made him very unpopular, and there was a lot of fear on the boat because so many people had been seen to die. And she writes that there were cholera medicines provided to the ship. Now, I don't think there would have been very many available, and it was probably opiate-based things to quell some of the diarrhea. No confirmation of that. And preserved potatoes and carrots. Perhaps the carrots and the currants might be the only sources of vitamin C. I don't see how they had anything else mentioned that was the anti-scurvy measures of the time. Roast beef and sometimes a nice cut of salmon. So that sounds like a pretty good diet for a voyage in 1849. And whooping cough broke out. Several children had it, and even two of their own children had it one day before they landed here in Otago. So cholera breaking out amongst the immigrants. No man was better qualified than Dr. Purdie to cope with this crisis, but it needed all his stern courage and firmness. And he had to carry pistols to awe some of the passengers into obedience. And Mrs. Purdie wrote about that as well, and this came from an article many years after his death in an Otago Witness newspaper, probably written by Robert Welpy Falcon. So can you see the little insects on the water in front of the boat? Well, actually, they woke up one morning, early hours, to find that they were nearly being washed aground against the rock cliffs of Tristan da Cunha, the island down in the bottom of off the west coast of Africa. And the captain ordered all the fit men to get into the boats and the longboats and row, and they spent many hours at this from Mrs. Purdie's accounts, and they all got kids. She got all the kids dressed and that. They're all ready to abandon the boat because they really thought there was no hope of. And everybody that came back noted how much drunkenness there was around. Yeah. Dr. Purdie went up in those early forays and bought the only house that was suitable and available for a family of his with 6 children. I'm going to cover his house quite a bit because it's in a landmark that's quite relevant to this city, and its medical history is perhaps of relevance too. So the early settlers here came in 1848, but Cargill rejected the house that had been built for him, especially by one Mr. Lees, after which Lee Stream is named, because it was too far away from the sort of the hub of the city, which was down by the Octagon area. It was very swampy between where it was built and down there. And Dr. Purdie came and found this was just the right sort of size for him and bought it. Don't know who got the money for it. Probably the provincial superintendent purse, I would think. But it had very difficult access for the rest of his practice, and he hung around there for a long time. This picture was in an Otago Witness issue many years later, well after Dr. Purdie's passed on, showing the little house in Pitt Street. And the wattle and daub house with 3 rooms has been subject of a bit of artwork from the Welpy sisters, for instance, and down in the Otago Early Settlers Museum. So wattle and daub really meant that the framework was put up and the walls were woven with sticks, branches off trees and then plastered with mud to make a plaster type quality. Note the couple of chimneys on it, and that was almost certainly done a little bit later than when Dr. Purdie first started living there. Down in the Otago Settlers Museum, you can see these photos. That's a picture taken quite a bit later, and the inside construction, I think you'll notice it's quite robust. And there's a little section of its wall which was kept for historic reasons down in the Settlers Museum. That is not part of his house. So when Dr. Purdie arrived here, there were only about 5 doctors in Otago, and I say about advisedly because there was Joseph Crocombe, who has been the subject of a presentation at these meetings, but he was down at Wakawaiti, Johnny Jones's whaling station. The first medical practitioner really was Henry Manning, who came on the John Wycliffe in 1848, and he'd trained in London. However, William Cargill considered him inefficient, and he was highly flamboyant in his dress and eccentric. When Dr. Williams arrived some months later the same year off the Bernicia, Manning took off back to Great Britain for a while and didn't come back till 51. But Dr. Williams had studied under Liston in London, and Liston had also, another one from Edinburgh, had overlapped with Simpson, and there's a bit of a closing of the gap there between these people. Dr. Chapman, I haven't counted as one of the doctors because as a homeopath, I'm not sure whether we should in this forum. And then another couple came along. Dr. Bennett was actually a private physician for Mr. Valpy, who was a rich English businessman, a merchant, and brought his whole family here. So Bennett didn't provide services to the city or province, and went back to Great Britain later on. Dr. Stewart, when he came, he went up to Monticello and Mornington and stayed there for a while, and later was offered by the superintendent after volunteering the position of surgeon superintendent of the Dunedin Hospital. But he went off on a voyage to China first before he took up that, and he died of a tropical illness there. So effectively, we didn't have many medical providers in Dunedin before Dr. Purdie came. Out of the first 14 ships, only 2 of them, the earliest one with Henry Manning, had a medical person before Dr. Purdie arrived in Christmas Day 49. And in his first year of practice, he passed on to others that there was little sickness in the province and even less payment. So this is this is a modern day map overlaid with what Dr. Purdie did. His house that had been originally for Cargill was just situated there, and he finally got the grants to buy the whole of this block, or the grants were given to him for that land. And you might notice Elder Street up there. Now, Elder Street's one of the streets they lived in Edinburgh, and there's a lot of other streets around here that you'll know are named after Edinburgh streets. Now, this picture's about 15 years after he came, looking down Pitt Street, and that's the house there. The picture in the Toitu has this penciled arrow on it, which I think points to the wrong one, and you can find a good description of this in the curators from Toitu's series that he did during our COVID lockdown to bring out various aspects of early Dunedin. But do you notice there an old Dunedin hospital that was the subject of one of my talks about Dr. Kloss, probably the first one I did actually, and you might just notice there a building which comes up better in a moment. But that was the second Dunedin hospital after it had been used as an international exhibition in 1865. So there's quite a few extra bits around this house that was Dr. Purdie's original and the only one on the site. And that was what you're seeing in the distance, the Dunedin Hospital, and a new bit of hospital built over here later on. I think this is Dr. Purdie by looking at all the photos there, and there's possibly a Purdie family member down there. I don't know what that's about. But there's that church building. And as far as I can tell, that is probably this one, which was the first version of the Hanover Street Baptist Church. There were 3 iterations of that church, and Dr. Purdie, being a Baptist, but had to go to Presbyterian, Knox Church, First Church, etc. after he first came here, because there wasn't a Baptist church. He set off as a founder of getting a Baptist church here. It's not the one you'll see as you go out down the road here tonight. So there's a bit of other history related to Dr. Purdie's house, because it went through some other things that might make some difference. It was going to be a site for a new Dunedin hospital, but it was rejected because it was owned by the property was owned by a medical man. And Dr. Purdie later moved himself up the hill to what is described in the Fulton's papers, 8 Newington Street, which I'm sideways interpreting as possibly Newington Avenue of today, and later came back down and died in the house that he lived in most of his time. But I think of interest, when I came here, there was a Bank of New Zealand on the same corner, and his trustees sold that property to the Bank of New Zealand. And then later, Dr. Maunsell, who has featured here in one of my talks before, and his name's on the honours board down in radiology corner in the hospital. And then Dr. Fulton buys it, and he goes into a place where he knows a fair bit of the history of the medical people of town, and he wrote some very interesting accounts of them all. So this appeared in the Otago Witness as an offer in late 1851 to vaccinate for free against smallpox with some material that Dr. Purdie brought out here with him for no charge. And although the item says introduced with good effect amongst several children in the colony, I don't know what evidence there was that whether it was effective, whether there was smallpox around here or not. That might have been speculation. Anyway, the generosity of providing for free is to be noted. And one of Dr. Purdie and Mrs. Purdie's last child was born here about a month after that advertisement. And she features also as amongst the features at Hanover Street Baptist Church. And coming back to his house, and that's modern day Newington Avenue, the place which I discovered is 8 Newington Street in today's numbering, which may not be correct or accurate, is just above the town belt. I don't know how coincidental that is, but if you say the doctor's going up the hill to Newington these days, it has a different meaning, well, another meaning. So his early practice here was described as arduous in the extreme, but not very lucrative. That came from Fulton, not very much, but notice that that's about 8 times more than the schoolmasters in Airdrie were paid, if they're comparable. But he had to get around the whole of this area right out to Port Chalmers and over the Taieri on horseback, and negotiate a lot of swamp stuff. He'd turn out at night with a hand lantern getting through these swamps, and once got tossed by his horse and broke a couple of ribs. Fortunately, this was a time when there was another doctor who was able to treat him, and he was grateful for what he was given, which I suspect might have been morphine type products. So it might have been described as arduous, but this is the town belt, recreation on the town belt. And this caricature here is of John McGlashan, W.H. Cutton, and Dr. Purdie, and I think they've captured out of what you might remember from the picture I showed before, his long nose. They're playing some sort of game where they're throwing things onto a place down on the ground marked out. So I don't know whether you can say it was always arduous. And this little sketch came out of a newspaper of him on his horseback with what was a characteristic cap. You might have seen it in the last picture. So comes to chloroform, which relates to my specialty, but I never got a chance to use it, of course. Dr. Williams here was the medical attendant on Mrs. James Fulton. She was one of the Valpy girls, married James Fulton, probably a shipboard romance when they came out here from all accounts. And they had quite a few children, to which Dr. Williams was the attendant. At Ravensbourne is not our Ravensbourne up here where the fertiliser works is, but over in the Tyree, and that was actually the name of their house. But being Dr. Fulton's mother, he was qualified to say that he had often heard her extol the blessings of chloroform for the deliveries, which were given by Dr. Williams. Now, Dr. Williams trained in England and left at a time before chloroform was discovered. So it's implied then that he could have only learned it off Dr. Purdie, and then he put it into both his obstetric and surgical practice, and he was described as a reasonable surgeon, whatever that meant in those days. I can't find any records like I could for some of the subsequent doctors like Kloss and de Zouch. Some of the operative work that Dr. Williams did, having to operate on the Chief Magistrate's wife for a very serious operation unspecified. The administration of anaesthesia was not documented, but probably by Dr. Purdie, the only other one that would have been qualified or able to do it here. Assisted by Mrs. Fenton, the wife of the Anglican clergyman who held the arteries. And I'm not sure whether that's sort of a slang for holding the artery clips, which would sometimes be called the arteries, and acted as an assistant because there were no nurses in the day. But the important bit is the patient did well, and her ailment, whatever it was completely eradicated. Maybe a surgeon in the room might be able to guess what it could have been. So Dr. Purdie combined his medical, religious, and public-spirited things in life here, and he was only here about a year and a bit before he was appointed a JP. It said that there were more people to sit on the bench. There was one person to sit on the bench for every 20 citizens here, so it was well covered. But things like the town board, the horticultural society, and he loved the things that were beautiful. And this important statement from him was that there was more to life than an everlasting race for prosperity. And he didn't look as if he made a big killing while he was living here. Some of that comes from writings of his son, who didn't feel like asking parents to help support when he got married. He had to go away for 6 years during a 6-year engagement to earn some money in a profession before he would get married, rather than ask Papa for any funds. So all these other things that he was involved in, and the Honourable Thomas Dick was another superintendent of Otago here, and he and his daughters were shown in images of people who were part of the Sunday school teacher cohort at Hanover Street Baptist. But also was he a business partner with Dr. Purdie, who bought Cottlesbrook Sheep Station, which was somewhere in Middlemarch. And this was run by one of Dr. Purdie's sons. For some reason, it had to be sold for some good reason, which wasn't specified in the letter that son wrote to his brother. So that suggests there might have been a bit of impecunity problem at the time. And that son, after spending some years there running a sheep station, decided he had to get a profession, went to Melbourne, became a dentist and came back, settled in Christchurch, and was one of the founders of the New Zealand Dental Association. So interesting connection. That's the Hanover Street Baptist teaching cohort, in particular Thomas Dick, and the intermarriage between their two families quite a bit. A couple of Mr. Dick's daughters, and the picture I had of Dr. Purdie's youngest was out of that same lot. So here they are. That's down in Toitu. It's not on display. It's out in the back collections. And Dr. Purdie retired from his work about 1864 and had about 12 years. And it's claimed that his reason for having to retire was overwork. And if you look at the date, 1861 is about the time the gold rush started, and Otago started to grow up quite rapidly as well, people supplying up there. And he, a great-grandson of Dr. Purdie describes him as a very sick and spent man at that time. His estate on probate seemed quite big, but maybe that wasn't big in terms of what was needed in those days. And then left to his wife. His wife's funeral started from the Hanover Street Baptist Church as well. She lived quite a few years longer. And that's the main things I needed to say about Dr. Purdie and his journey. But I've done this little cartoon here to just try and put a few of the timing things into perspective, and a statement that's in one of the writings of Dr. Fulton. Dr. Purdie was born just 3 years before the turn of the century, and his time in Edinburgh, or doing his medical studies, was round about here, and then his practicing life in Edinburgh after he's gained his MD from Glasgow overlaps with the time that Simpson discovered chloroform, and then there's that little window I pointed out before of about 2 years before Dr. Purdie comes to Otago. Green is people in Otago time. And it was after he came here before Queen Victoria had chloroform LOM. So getting the word spread around, it was probably quite remarkable that here in little old New Zealand, Dr. Williams, taught by Dr. Purdie, was giving chloroform in labour analgesia, not as well as surgical procedures, but ether was still favoured. After a little while, that it grew up as the preferred in this place. So the likelihood is that Dr. Purdie was in Otago here during the times of Dr. Wilkins, who was my last talk here, and Drs. DeZouche, and possibly just overlapping with Dr. Kloss. Whether they got together or not, these people were secretaries of the Medical Society here in Dunedin, and Dr. Purdie kept in touch with medical affairs throughout his life, even though he wasn't always practicing. Now, one of the statements in the writings of Fulton was that Alexander, having examined these of Purdie's lecture cards issued to the students, all more or less of historic interest, but one bearing the name and signature of Alexander Munro, Professor of Anatomy, is worthy of special attention. The card is an unusually fine one and has embossed upon it a medallion of Alexander Munro, Secundus. Now, we've had a talk about the Munro Professors of Anatomy in Edinburgh by Mariana here before. However, Alexander Munro died in 1817, which makes me doubt that they could have even crossed paths. And this is Secundus's time span. I haven't got all the years on the bottom, but I don't think he overlapped the time that Dr. Purdie was studying those 11 years. This is longer than an 11-year difference here. So I think it's most likely that it was Alexander Munro III, and perhaps he was dishing out his father's cards still. Not sure. He was described as a lot less organised and unruly and not such a good teacher as his predecessor, grandfather and father were. So I give you a story of one of our earliest doctors and the journey he took to get here. Thank you.
Thank you very much, David. Fantastic. Any questions in the audience?
I'm interested in the cholera, but I don't get it. Is cholera mentioned in the ancient world at all?
I don't know that it had a name like that, but there are plagues of things that wiped out lots of people through gastro-type problems. Sorry? Not mentioned.
No.
Not the word, no, but the conditions of people dying of gastro conditions, I think is.
But it's a population density thing, and clean water.
Water and proximity, certainly. Overcrowding.
Just don't know how to get into the ship. How do
Yeah.
you get into the ship?
Well, the Thames was a dirty sewer, and oh yes, they did for Dr. Purdie leaving here, but cholera in London came down from Scotland
So
in
they-
that third epidemic.
So they must have been taking the water from the London pumps onto the ship.
Not necessarily, no, not from Glasgow. I don't think so. They were
Oh,
probably
right.
taking good Glasgow water, most likely. Yes. No, the people, of course, they believed the bedding was what brought it onto the Multan. And they got rid of that and jettisoned the bodies very quickly, so there wasn't much opportunity for other contact. And then the strict measures of cleaning up and stuff like that on the boat, those are what I understand he did. But Stephen, yes.
A family connection in my stepmother's family to the Broad Street pump and the cholera there, and that my mum's great grandfather and his two siblings were orphaned during that outbreak, and was subsequently sent out to other members of the family who'd already migrated to New Zealand.
Okay. Which boat?
They went through to the Wellington and the Wairarapa.
Oh,
So it wasn't at the centre of the country.
That's to comment on the question asked by a gentleman there. I'm not a medical person, but until the end of virtually the end of the 18th century, medical conditions had not been classified in any systematic way. So it is possible that there were individual physicians who knew about cholera, but there was no systematic classification. So my question, he did his training in, you said a shop. Was that an apothecary shop? Because a lot of apothecaries in Britain were also surgeons.
Yes. I can't answer accurately.
No, it's just something.
I just took that shop word out of the writings, which are written here in Otago some long time after, with some of the documents at their disposal, like paperwork that Dr. Purdie brought here. That's where those apprenticeship testimonials came from. He brought them with him.
Can I just make one more comment on
Of course.
that? Until the end of the 18th century, there were medicine was individual doctors knew things, but they had their own personal views on medical conditions, so to speak. And then gradually, after William Purdie MD, we had classification of.
I was just wondering if some of the classical writers in Rome or Greece might have mentioned outbreaks of diseases or plagues in cities and described them, because they were pretty descriptive
There were
writers.
some conditions like gout, etc., weren't recognized. There was some sort of a systematic.
And malaria was recognised and named in the ancient world. But there were certainly plagues that sound cholera-like.
Yeah.
Massive gastrointestinal maybe, you know, symptoms, but they weren't named as cholera.
David, when Dr. Purdie arrived in Dunedin, the Dunedin Hospital was built. Is that correct?
No, no.
No.
The only hospital was what was called by some the lunatic asylum, down where the town hall is at the moment. Before there was one built, not built, but it took over the exhibition building in 1866. And then there were other Dunedin hospital versions.
So he
It's
did
still
not.
going on
He did
today.
not work. I mean, which hospital did he work at?
He didn't work in a hospital.
So he works. He had his rooms.
No rooms.
So how did he work?
He went out on horseback when people came to him on foot or horseback to with messages like the difficulties he had traversing out over to Port Chalmers over the hills, where there weren't any proper tracks on that. They're described in several places how difficult it was for him to move around through the swamps, but somebody sent either a smoke signal or a messenger to him first. His house up here on the corner of Pitt Street in London was a shining beacon for people to find their way through from the imbibing down here and past his house. So his house was very distinctive and would have been easily found by people that said, come out. And he'd take many hours, half a day, to get to some of the sick. So it does not like we think of medical practice these days, out of rooms and in hospitals.
Now, the other thing, did he use chloroform?
Sorry?
Did he use chloroform on his patients? Did he do surgery?
I don't see anything that says he did surgical procedures here in Otago. I think most of his surgery was actually back in Scotland. And although he's listed as the ship surgeon, that's a term they use, not a function.
But chloroform was used here in Dunedin quite early.
Yeah, 1851 too. Dr. Williams was using it, but taught by Dr. Williams was a more surgically experienced person when he came here, and ether was available. You remember we're talking about 1846 for ether. And that didn't take long to get to this country. And chloroform in 1847, there's not much time gap. And then there was a lot of debate about which was the better. And chloroform easiest to give, nicer to have, but later on discovered to be associated with more deaths. So it was Dr. Williams, as far as I can tell, who used it most in the obstetric practice.
Thank you.
Thanks. Do you know the answer to Haiti?
Oh, yeah. I mean, Haiti never had cholera until there were UN troops who were in Haiti, and it was traced back to UN soldiers from Nepal. They introduced Nepal. Yeah. They introduced the cholera into Haiti. That's my understanding. And I certainly worked there during the cholera epidemic. But I was told by the Haitian doctors that they never seen cholera before until it was introduced by the UN troops.
Was that connected with the earthquake? Were they like rescue?
No, it was after the earthquake.
After the earthquake,
yeah.
Going back to the original choleras in London, a lot of those were associated with ships coming in from the east. And there were records of severe diarrheic illness in the east. And some wise people in London said, we must isolate these ships or not let them come in. And all hell broke loose for the commercial side. And the commercial side, as so often happens, won out, and more ships came and more cholera came.
And they didn't know the cause of it, the real cause of it. They twigged that water was involved, instead of air, but my asthma stayed as a theory for a long time, including most likely on the boat that Dr. Purdie came on, the people that he was dealing with believing it's in the air. He might have had better insights.
So this is way before antibiotics. Yeah. So it was kind of asepsis for the using at the time. Was it carbolic or were they using Lister's carbolic?
Lister, I think it was carbolics, earlier surgery.
On the ships.
On the ships,
They used sort of water, sort of a lime.
The
lime wash.
The lime wash was in the closes in the street around the township.
But I think they used them on ships and also used to burn sulphur.
Okay, well that's good. We get some more info out of the audience.
Do you know what they were using here in the surgeries that they were doing here? How they were their asepsis?
Well, as far as I know, Liston's earliest work was carbolic, and Williams did surgery with Liston, who was supposed to be one of the best in London originally, before he came here.
And now with modern cholera, the treatment relies heavily on rehydration, even more than antibiotics. Because most cases, if you can get them early and have adequate oral rehydration fluid, that saves more lives than the antibiotic itself.
But I didn't go into cholera at the greatest depths, but for modern day, it lists antibiotics for the more severe cases and prevention of the dehydration where the complications came from. Cholera wasn't my main topic. Okay.
Fantastic. Thank you very much, David.
Thank you for coming.